Again, my name is Dr. Paul Nassif, and Dean did my nose about 2.5 years ago. It was my 4th rhinoplasty, and I have to tell you, I'm extremely satisfied. I probably couldn't be happier. And the interesting thing is when I went to Dean, we talked about what I wanted, what he thought I should have, and we came together in a great decision. And this right now, from what I have now, take a look at my nose. Nice sharp tip, lengthen it, I can breathe, I feel good, my incision of my rib is small, so you have one happy patient here. So let me tell you about my nose. So I had skin cancer many years ago. You can see this, there might be a little scar right there. And this nostril on the left was pulled all the way up. It was what we call alar retraction. I mean, if you look at me back in the old days when I was on the Housewives of Beverly Hills, you can see my nose, how the nostrils were uneven, lifted up, and I couldn't even think about how would I even correct this. And this is me, who's a fantastic nasal surgeon. And I said, I went to Dean, actually I saw Dean at a medical meeting in Chicago. And we looked at my nose and he just said, Paul, he goes, come on, look at your nose, man. And we go, you're a nasal surgeon and you have a nose like that? Yes, he actually said that to me. And I go, well, what can you do? So we talked about it, and after coming up with a plan, which was absolutely incredible, which was taking something called a composite graft from my ear, which is a big piece of skin and cartilage, and putting a small one in my right nostril, putting a very big one inside my left nostril, and also inside where the scar was. Opened it up, put it in there, and slid my whole nose down. This right here, what you're seeing, is absolutely about a good 95% improved. So I had a bad nose. I mean, my nose up here was over-rotated. It was cut off short. I was collapsed in the middle. So a lot of things I discuss about on TV, I talk about placing septal extension grafts and spreader grafts and composite grafts and rib, all that I tell my patients, that's what he did to me. And it's the first thing, as a matter of fact, I was sitting with a friend of mine last week, and I have patients say this all the time, well, I want your nose. And so I'll actually show a guy, a male or a female, I'll say, look, take a look at my nose. What do you think of it? This is the aesthetics that I like. And so Dr. Toriumi and I have pretty much the same aesthetics. When you take a look at this profile, this is a fantastic profile, and I love it. I love my nose. It was very, very difficult, especially really correcting this area where I had my skin cancer. And that skin cancer I had when we took out the tissue really messed up my nose, especially from the nasal obstruction standpoint. I couldn't breathe. Now I can breathe fantastic. And listen to this. I mean, that just makes it so much easier for me to do activities, to exercise and everything. It's just, you know, the snoring has also been cut out. Yes, I had a little bit of snoring. So what is Dr. Dean's ability to repair other physicians' work? Well, obviously, first of all, I'm a physician. And the types of cases that deans get is pretty much all of our friends across the country, especially on that side, will say, Dean, can you take care of this nose for me? I'm not happy with it. Whether it's their own revision and the doctor just couldn't fix it, they send him to Dean. And so his ability to do that is impeccable. Well, why is Dean a physician's physician? Well, first of all, one thing that, especially when I was just getting into head and neck surgery and facial plastics, I heard Dean talk at one of our meetings, and I'll tell you one thing, it was probably some of the best pearls I've ever heard of, especially in rhinoplasty. Up to this day, Dean goes across the world, across the country, lectures. As a matter of fact, we're here in Los Angeles right now. We just both spoke at a symposium for rhinoplasty today, and it's one of these things where when you go across and you get invited across the world to speak about nose, rhinoplasty, well, obviously, you become a physician's physician because these doctors see the type of work you do, and whether it's their family members or the physicians themselves like me, and I'm a rhinoplasty surgeon, I mean, that's the best compliment you can give someone. Someone like me especially, who does very complex cases, I went to Dean to get my nose fixed. I mean, that right there says it all. I think Dean, when it comes to fixing these complex cases and also aesthetic style, are far superior than any doctor that I know. I mean, I've been listening to Dean talk at lectures probably for 15 years. And the way he does things, the way he's a thinker, and the research and generated. And so if a little procedure is done, it's not like, let me just do that procedure. Dean, what he'll do is he'll sit, he'll think about it, then they'll study it, then they'll write a paper about it, and then they'll have 10-year follow-ups. That's the kind of doctor that I want to go to, and that's what I did. When it comes to revision rhinoplasty, and this is what I tell my patients, I say, you know, you're not going to be happy completely. You're not going to get 100% improvement. You're going to get a very good improvement, especially if you've had 3, 4, or 5 rhinoplasties. And you are going to have some asymmetry and irregularities no matter how good of a job I do. Not because at the setting of surgery I did or Dean did a bad job. It's because what we call the shrink wrappage of the skin and the three-dimensional healing of the nose, that's what causes the irregularities. So let's take me, for example. I had a really bad scar here. And this was pulled all the way up and retracted. And I think maybe after it's been 2.5 years now, you know, I can see maybe just a smidgen of a little touch-up just to get the scar a little bit better. And that's not because of what Dean did, it's because of the healing, because I had something that most doctors don't do. I had a large composite graft from my ear placed right inside the corner of my nose to my cheek. Okay, and that's called the alar facial crease or groove in that area. It looks fantastic. It really helped my nostril. In addition, I have something called lateral curl strut grafts placed in my nose, and those are pieces of rib cartilage that open up my airway, and it spreads open. And as a matter of fact, the right one here, it came in just a little bit. And that happened after a year. It's not technical, it's the way my skin heals. And I have a piece of bank cartilage. Yes, it's kind of weird, though, I will say. A little piece of rib cartilage right back here. And, you know, I'm probably going to go back soon, have Dean take that piece of cartilage out, because I think I'm healed now, take it out, and possibly revise this side right here, because once, if it pops right over like this side, I can breathe. Instead of 85% better, it'll be up to about 95%. And compared to the aesthetics that I've seen, especially what I had, this is about a good 90% improvement as compared to what I had. So I can tell you now that I'm ecstatic with my results. And of course I'm sitting here, it's almost like, you know, why am I doing this? Dean's my friend. And the point is, if I did his nose, which he doesn't need it obviously, but if I did it, I'd want him to do the same thing for me. So this is the best thing, giving him a testimonial, talking about the job, the work that he did on me. I mean, it says it all.